Okay, today we're here at Guilford Pediatrics to talk with Dr. Robert Nolfo. He's a great pediatrician about the role of the pediatrician in getting the initial diagnosis of being on the spectrum, as well as the interface between the pediatrician and the family and the kid on an ongoing basis. We're going to ask him some questions. Let's go. Hey! Oops. How you doing?
Nice to see you.
You too.
Do you want to come back in the office and talk?
Please.
Come on.
Okay. So when a parent comes in and has concerns about their child being on the spectrum, what is the range that you see here?
What's common among all people on the autism spectrum is a fairly profound social defect. It's the inability to make good eye contact, from the most profound nonverbal ones to the higher functioning. They still have that fundamental social defect, which is the inability to really connect with another person.
Is there some more standard way, some evaluation that a pediatrician can do to help a parent answer the question of whether their child might be on the spectrum?
So one of the tools that we use to help us screen for autism is the MChat. The MChat is a screening tool that is used by clinicians to help determine the risk of a child for being on the autism spectrum. Does your child enjoy being swung, bounced on your knee?
Sometimes.
Okay. Does he take an interest in other children?
It seems when we go somewhere, like if we have a play date or we're going somewhere, he tends to shy up around the other kids to where he clings on to me.
The fact that he may be clingy when he goes into more social situations may not necessarily be something to be concerned about, because this might be his temperament, you know?
Okay.
Yeah. Does he like climbing up, like going up the stairs?
Not all the time.
Okay.
No.
Does he enjoy playing peekaboo and hide and seek?
No.
Okay. Did he ever?
No.
Okay. Does your child ever pretend to talk to the phone or take care of a doll? You know, like kind of pretend behavior, making believe he's playing house, talking to his doll?
Sometimes, but it doesn't last that long.
Does he ever use his index finger's pointer to point to objects like you want something?
Sometimes.
Okay. So again, this is not something to be panicky about. It's something that you should be happy that we're recognizing right away and dealing with right away. I believe that this is the perfect age, to go through the MChat. The purpose of the MChat is that, in spite of how good doctors and parents are at observing children for risks of autism, these questions weed out even more patients who may be at risk. For example, when your child is playing with blocks or stacking blocks, can he stack the blocks nicely without mouthing the block or fiddling with the block frequently? Okay, now I'm going to roll the ball to you, all right? Should I roll it?
Yes.
Okay, here I go. Okay, now roll it back to me. That's a good roll. So you can see the way I interact with the patient, and although these tests that I'm doing with the patient right now are not very specific or sensitive, it's just a piece of information that helps me determine whether this child may be at risk for autism.
All the things that happen in a regular checkup can be extremely challenging for a family who has a kid on the spectrum. They don't like changes in their routine, they don't necessarily like being touched, certainly being hurt with shots. So is there anything that a practice or a doctor can do to support the family in helping the kid get the services, the regular well visits that he or she needs?
One of the things you can do is have the child come to the office on a non-visit day, just to kind of walk through the office, familiarize himself with the hallways, maybe go into an examination room and even wave to their doctor, and then have a couple of non-threatening interactions in the office to make them more comfortable.
Are there other roles that you play in the life of a kid or a family on the spectrum in terms of getting services or referring to specialists that people should be aware of, that this is a way that a pediatrician could be of help to a family?
The pediatrician can be helpful in continually writing letters to the schools saying, I believe that this child needs more hours of occupational therapy or physical therapy or speech therapy to help meet the needs for their diagnosis. The job doesn't end with the diagnosis.
Hey, Dr. Nolfo, thank you so much.
You're welcome. It was
Really
my pleasure. This was great, and I appreciate being invited to do it.
All right, see you soon.
All right.
Okay, bye. I hope you got a lot out of that conversation with Dr. Nolfo. I encourage you to bring your vulnerabilities and your worries and your concerns about your kid to your pediatrician. As scary as that may be, in the end, if you are in need of special services, your pediatrician can be your #1 advocate and support on a big team of people who will help you get to where you and your family need to go.
Nice big deep breath. Fantastic. Even bigger. Breathe in and blow out. Attaboy. Again. Nice and big. Fantastic. Hey, where'd you learn how to breathe like that? That's great.